Hello, everyone, and welcome to the International Essential Tremor Foundation podcast, Talking Essential Tremor. This series is going to explore a variety of topics on essential tremor, including symptoms, diagnosis, treatment options, support, new research, and much, much more. My name is Patrick McCartney. I'm the Executive Director of the IETF. And before we get started, I want to thank our corporate partners whose support allows the IETF to continue to host this podcast, our virtual education webinars, and our in-person ET education forums. Thank you to Medtronic, Cala Health, Jazz Pharmaceuticals, Sage Therapeutics, Boston Scientific, and Praxis Precision Medicines for their generous support of the ET community. Today, we are talking with Mantis Venslauskas, who is CEO of Vilimed. Vilimed is a medical technology company based in Lithuania and also the creators of the VILIM ball, which is a handheld therapeutic device which temporarily reduces hand tremor. You've probably seen a lot of conversations about this device, so we wanted to talk with Mantis today and hear it right from the source about the product itself. So thank you for joining us today, Mantis.
Hey everyone, and thank you, Patrick, for the introduction. Happy to hear there. Happy to talk about our device. Happy to be here where lots of ETers can hear about us, about our device. And thank you for inviting me.
Great. So let's get started. So describe the VILIM ball and just talk generally to us about how it works for patients with essential tremor.
Yeah. So VILIM ball is, like you said, it's a personalized handheld therapeutic device that targets the source of tremor and which purpose is to temporarily reduce hand shakiness, giving essential tremor and Parkinson disease patients a relief from symptoms for some time period when they need to perform some ordinary life tasks. And our device simply monitors what's going on in patient's hand and produces unique artificial intelligence algorithm-driven vibration, which disrupts neurological loop, which causes the tremor. And after 10 minutes of therapy, patient can just put our device down and feel benefit of it for the next few hours. And VILIM ball device contains sensors that feed data into algorithm which monitors the level of tremor during the therapy, and it personalizes the parameters of vibrational therapy, which helps to maximize its effectiveness. And customer should use this in the beginning for at least 14 days to make it fully personalized. So only after 14 days, customer can feel the maximum potentiality of the device, which can help to reduce their tremors.
So VILIM ball's effectiveness at calming hand tremor was kind of discovered by accident. You were kind of going a different direction. So tell us that story.
Yeah. So first, before telling that story, I want to say that I have seen people with tremors since my childhood, and my best friend in primary school had it when we were like 7 years old, something like that. My grandfather was suffering from Parkinson's tremor, and I knew all the time how difficult it is to cope with trembling hands. But I believe that breaking point for me was at the time when I was preparing and writing my PhD thesis. I was investigating vibrations, and at that time I started to think about different fields of applications, because at that time I was trying to find a way of how to improve blood perfusion with vibrations. But by having in mind the tremor and people with that problem, I always was wondering of how the technology I was working at could help for them. So I remember very well when during one defendant's session of my intermediate PhD results, one professor advised me to adopt my technology for tremor damping. Unfortunately, at that time, it was impossible to have that kind of result with the technology I was working at. But it helped me to think much more about the application of that technology for tremor reduction. And actually, it's talking about our company, our startup. It's something like a classic story which happens to almost all startups. When you start to work with one product prototype, with one idea, but at the end you have completely different result or slightly different result, but in our case was totally different application of our technology. Of course, we had to adjust technological solution as well, but I can say that in the beginning we were targeting in morning stiffness reduction for arthritis patients. Technology and the device, which was really similar to Vilimed ball, it worked in a little bit different way, but it showed quite good results. We got significant, statistically significant stiffness reduction. But the problem was that those patients had other methods of how to reduce that morning stiffness. And those methods were quite simple, just to put hands under into the warm water, or to do a massage with just simply with your hands, and it helped them also. So we had good technology, and we were always had a good relationship with health scientist in Health Science University of Lithuania. And one day they asked us to give a few samples for testing, samples of our prototype for testing with group of essential tremor patients in their hospital, because they knew that vibrations might help for them. So when they tested, they reported as positive results, and it was kind of direction to our company. So it was kind of an accident, but it was, it's like a consequence of different actions and different reactions from some people.
So tell us, what do you have your PhD in, just so folks know about kind of a little bit about your background?
Yeah, so it was, I can tell it's like in a biomechanical field. I investigated vibrations influence on blood perfusion in capillaries. So I developed a few prototypes, and I proved that vibrations could be really helpful in improving blood perfusion, increasing blood perfusion, and we faced some difficulties in applying that technology and some medical fields, and it was designed to improve blood perfusion in legs. So I had to rethink to adapt everything for hand tremor, but we did it in a company. It was like a spin-off from our university, and nowadays it's a completely different technology what I had when I was doing my PhD thesis.
So talk to us about how you tested the efficacy of the Vilimed ball. How many clinical trials were held, and what were the results of that, and who was all involved in that clinical trial? What was the group involved in it?
Yeah, so in the beginning we worked together with those scientists from Health Science University, which is quite close from the office where is located in Kaunas, Lithuania. And the good thing is that we are the environment where our company is called the Santaca Valley, and that valley involves various scientists from different fields, from technological field, from health science, and others. And we have quite good relationship with all of the scientists, and it helps to develop different kind of innovations and technologies. So as a young company, as a company trying to build an MVP product, test it, and enter the market, we use that collaboration benefits from that collaboration with scientists, and we asked them to test our product in the clinics and in the hospital, and we published 2 studies at the moment. One is submitted to the peer-reviewed journal. I'm going to share a little bit about findings of those studies. So the first paper which was published describes 2 studies, and one was prospective single center randomized controlled study, and it was designed to evaluate device efficacy, and small group of subjects, but 17 subjects with essential tremor were randomly selected to an active group, and another group of 15 patients were selected to sham device group, and study showed efficacy and safety of Vilimed device in comparison with sham device. Then we had another study which was performed on patients with essential tremor and Parkinsonian tremor. And in total, 50 patients were included in that study, 30 in essential tremor group and 20 Parkinson's tremor. 46 reported improvement in tremor symptoms, and 4 reported that there was lack of effect in terms of symptoms and function. And there were also 2 studies conducted with Parkinson's patients. One paper is submitted, which I mentioned you before, and that study describes a trial of 24 participants. They were divided into 2 groups. One group performed physiotherapy. The second group performed physiotherapy and used Vilimed device. And it was found that the group which performed the physiotherapy with Vilimed device had significantly higher improvement in therapy in comparison with the one which was only physiotherapy applied. And also Dr. Dieter Wolk, Austrian specialist in neurology, is performing internal study focused on Vilimed therapeutic effect on Parkinsonian tremor patients. And even though the conclusions are not yet public, latest recorded data concluded that tremor reduction was observed for 19 of 25 PD in Parkinson's disease patients. We also do post-market studies. Intermediate results are always updated, and those can be found on our website. So we are going to update that page in upcoming week. So everyone who wants to find and learn more about those studies can visit our website.
So we connected, the IETF connected with Vilimed, a number of years ago. your product has been listed on our website as an option for a treatment option, but until recently, it was only being marketed and sold in Europe, and that's changed. So tell us how that change came about and how folks in the United States can now purchase the Vilimed.
Yeah, sure. So first, there are like two reasons behind that. So the first reason, when we finally launched Vilimed device, we got certificate. We were extremely happy about it because that was our goal. And then COVID happened, and we just simply were not able to start manufacturing due to shortage of microchips. Only about a year, we were able to restart our production. And at that time, we were focusing on the European Union market only and fundraising activities, because as a startup company, you have to raise some funds for like initial production, initial marketing cost, at least to find doctors and patients who would be willing to start to test our device. And that was the goal of our company. So we were not focusing on the US market at that time. And only last year we started to observe the US market and possibilities to sell our device here. And last year I was visiting Medica Fair, which is one of the biggest medical devices exhibition areas, I can say. And in the US pavilion, we met one consultancy company which helps to get FDA approval for EU-based medical device manufacturers. And we started to collaborate with them. In the meantime, we contacted different specialists and consulted them if it's possible to sell Vilimed in the United States without FDA approval, prior FDA approval. And according to FDA, Vilimed is a low risk of harm to their users' device, which are subject to general controls only, and most similar devices are exempt from pre-market notification requirements. So we can basically sell it by claiming that statements regarding the device have not been evaluated by FDA while we are in the procedure of certification.
So you are going through the certification of FDA approval, but they've given you
definitely.
Okay.
Exactly.
So we make sure everyone understands that too.
Yeah.
So we also know with other things in the ET communication or community, the medications, different things, what works for one person may not work for another, and Vilimed is no different. So if the Vilimed, what happens if people order the Vilimed and it doesn't work for them?
Yeah, we know that very well. We knew that from the beginning, and we always were telling to our customers that it is okay to try our device and to return it back if it doesn't work. In case of the US customers, we actually very recently heard that US Post Service, I believe last year, decided not to allow to send any electronic devices with batteries by airmail. And that could be an issue for a return. But that's why we decided to give an option for the US customers to return it to the US location. So everyone who purchased our device from Lithuania and try it for 14 or even more days, because we can give up to 30 days of testing period. So after the testing period, if the customer isn't happy about the device, if the Vilimed doesn't meet their expectations, it can be returned to the US address, to the US location. So there are no restrictions regarding it because it's a ground mail. So that's easy. I think that's a convenient option for US customers as well.
Yeah, because one of the misperceptions that's out there is, oh, it costs almost more to ship it back to Lithuania than it costs to buy the device. I don't know people are aware that you ship it to the US, so it's no
Yeah.
different than shipping anything else around the country.
Yeah, I believe that definitely it's possible to find an option which can be a few hundreds of dollars to ship back in Lithuania, but to find the most expensive couriers, the fastest shipping, and the cost would be extremely high, but we don't advise to use that. So
One of the things you and I have also talked about is not every device that uses vibration reduces tremor. So why is that?
yeah, exactly, because it's that the problem is, I believe, and it just we never thought that we have to talk about it, but I think we should. That it doesn't mean that if any kind of device vibrates, it should reduce hand tremor, because there are so many differences between vibrating devices. For example, even our smartphone can vibrate, but it doesn't mean it will reduce hand tremor. The first thing which distinguish our device from any kind of other vibrating devices is that it was designed for hand tremor reduction, and personalization is the one thing. The other thing is the level of vibration exposure. We developed our device according to ISO requirements of safe vibrations. The use of any vibrating device, I believe, might cause even Raynaud syndrome in the long term, because if the vibrational exposure exceeds the limits, then it becomes too risky to use for human beings. And other thing is that cheap devices, I mean, any kind of vibrating rollers or vibrating balls that can be found on the internet, usually cannot be repaired. They don't offer any kind of support services. They might be risky because of not safe charging units. And so it's not correct to say that any kind of other vibrating devices are alternatives for Vilimed ball, because just they simply aren't. They just simply emit different vibrations. They are not adaptable to the user tremors, and it we cannot compare. We cannot say that if it vibrates, it's an alternative for Vilimed ball.
So Vilimed is well known in Europe as one of the great startup, and you've won a bunch of awards for your innovation and creation of the Vilimed ball. Tell us about some of the awards your company has won over in Europe.
Yeah, thank you for that introduction. Yeah, we won a number of national awards. We were nominated in a number of different competitions internationally. The recent one is Baltic Innovation Prize. We also won second place at Zambon Pharma Accelerator a few years ago. We were European Youth Award winners in fostering health category, and some more. Also, a branch of well-known brand Red Bull made a short video about us and published on their social media channels some years ago. And actually, there were a lot, but I can honestly say that most important awards for our team and our company are shared feedbacks and experiences of people who are using our device and improvement in their tremors. When we see videos or photos of happy faces of some things which they were able to do after so many years, like everyone in our company see those comments, we share those feedbacks among our teammates, because that's the biggest motivation for us and for our company. I can honestly say that it's like the most important thing for us, not awards from some kind of from governments, from companies, but real world experience and real world feedback. That's the biggest award and motivation for us.
So as we talked about earlier when we first got started, there's been a lot of talk out there about the Vilimed ball. So if someone, a patient, ET patient, whoever, wants to learn more, get the most accurate, most up-to-date information about your company and about Vilimed ball, where would they go to get that information?
So that's definitely our website. That's the first point, the first place where you can find the up-to-date information about us, about our company, about Vilimed ball device. Definitely Facebook page. We always try to respond as soon as quick as possible. So we try to respond even email messages or Facebook messages, that doesn't matter. I just can say one thing, that for the US customers, there's a difference in time zone. So sometimes we cannot respond in few hours just because of that difference.
And you got to sleep, right?
Yeah. Yeah, just a little, but we have
to. So tell the audience, so what is your website address, and if there's like an email address that they want to respond to?
Yeah, website address is vilimed.com, and the email is info@vilimed.com.
Okay, perfect. So, well, Mantis, thank you for taking the time to speak with us today and sharing information about Vilimed and the Vilimed ball. I wonder, we were glad we could get it, kind of straight from the proverbial horse's mouth about what the truth is about your product and your company. So, folks, if you have any questions regarding essential tremor or the Vilimed ball, please visit our website at essentialtremor.org, or you can call us at 888-387-3667. Finally, if you are a donor to the IETF, we thank you for your support. If you aren't a donor, we hope you please consider a gift to help us continue the work we do, promoting ET awareness, education, support, and research. The IETF will be hosting a variety of virtual ET education events in the upcoming months. So look for updates about these events in your Tremor Gram e-newsletter, on our social media, and in our Tremor Talk magazine, along with our website. So Mantis, thank you again for joining us today, and hope you have a great day.